Good good morning, everyone. It's a pleasure to be here. And actually, I love that concept about policies should be based on science. And when I was first starting to do research, that of course was there was no questioning about it. And then I came tonight and I realized that science is not necessarily sufficient or enough to guide policies. So my perspective on all of this is how can we work together so that the knowledge that we have can be used ultimately for policy. Unfortunately, we don't know much about Kratom. We know certain things, and you're going to be hearing about it, and that is actually can guide many of the recommendations. But what we do know is that we are living in the United States the worst overdose epidemic that we have ever had. We're seeing a significant increase in suicide, and we're seeing the struggles that patients with pain have to deal on a daily basis. And the truth is that we don't have sufficient strategies to help all of these people that are suffering. How bad it is? Well, for 2022, the preliminary numbers at least show that more than 110,000 Americans died from overdoses, just overdoses themselves. And we also know that patients that are struggling with depression and are also struggling with severe pain are also dying from suicide. And it's in this context that we need to understand and to hear the voices of people that are telling us their stories, sharing them with us regarding how Kratom has been useful for them, as we have just learned. So, what do we know? We do know that Kratom is a plant, and as you have been hearing it, similar to the coffee plant. It is a traditional medicine used for centuries in Southeast Asia. It's basically taken by the oral route as either dried kratom, leaf power teas, foods, or beverages or leaf power filled capsules. That we know that there is a market that is increasing with no regulations, with increasingly more powerful extracts. From the perspective of my pharmacology and understanding about why people are using kratom, we know that there's specifically the main active ingredient is mitragynine. And the mitragynine gets metabolized when you take it by the oral route to a certain extent into a metabolite 7-hydroxymitragynine that is also believed to play a role. But we also come to recognize, and the slides did not show it. Let me see. No, the slide disappeared. So you are getting the right one. You're going to be seeing the slides disappear. We know that there are 40 chemicals that in the kratom plant that are likely to have to underlie why the products that people take vary depending on where they get it. We know, and a lot of from the work from mitragynine, most, as I say, most of the work has been targeting mitragynine and 7-hydroxymitragynine. We know that mitragynine, but much more 7-hydroxymitragynine, binds to mu-opioid receptors. And opioid receptors are the ones that are basically activated by heroin and fentanyl. But it does it at a much lower potency. And actually, we use medications that target these receptors to treat opioid use disorder, most notably buprenorphine. And we can use it because it has low potency in activating that receptor, but it does control craving and withdrawal. Well, we now know that mitragynine is much less potent than buprenorphine. And 7-hydroxymitragynine is slightly more potent, but it's much less than what we know about. And we also know that it binds to many other receptors that are likely to be relevant in its pharmacological effects. And this also may explain what people are telling us and what the laboratory experiments are saying to us, that low doses seems to produce stimulatory effects, presumably by activating receptors that are stimulating and not necessarily the opioid receptor, but high doses actually are sedative, and that may reflect, in fact, that very low opioid receptor effects that it has. We also know, and because we've all been following the data, that people that die from overdoses, a small percentage of them had kratom in their bodies. And we also know that in even a much smaller number of them, kratom was the only substance. And that number is very small. I want to reiterate. Now, When someone dies from a kratom overdose, which is important to understanding its effects, we don't have the mechanisms that kills people from opioids. When you take an opioid at high dose, you stop breathing. When you take kratom, you don't stop breathing. And in the instances where there's been fatality, it's associated with its cardiac effects. It's a stimulant, and in people that have the vulnerability, it can produce arrhythmias. We also know that when people in animal models, in fact, we can use mitragynine to block the rewarding effects of heroin, and we can use it to also, interestingly, block some of the effects of opioids, which tells us that this drug is interacting with a receptor in a very different way from the classical ones. And as I said earlier, kratom contains more than 40 alkaloids, and we're promoting research right now to investigate them further to go beyond just mitragynine and 7-hydroxymitragynine. What is the prevalence of kratom use in the United States? I wish I would know. And I was looking at the literature and I got very disparate numbers, from 2 million to 5 million to even more. So the bottom line is we do not have good data indicating of actually what is the prevalence rates of kratom. And we've been discussing with our partners in other agencies to try to include questions that address the use of kratom as part of the annual screening that we do across the United States. Also, investigators have published data that actually looks at people who have been taking kratom and reported that tend to have greater severity of use of other substances, which actually in a way follows the narrative that we hear here for why some people are using these drugs to basically control their addictions. And we heard one from an opioid, a person that was addicted to opioids. So it is one of the reasons why people take kratom, apart from pain, as you saw, but it's also used for alleviating depression. And there are many areas that seem to indicate that kratom, when we compare it with other opioid agonists, is much, much less potent, and that highlighting its pharmacological effects are likely to relate to its mixed pharmacology. Can one become addicted to kratom? And this is an important consideration, of course. And we know, and there's been published papers that indicate that there is a kratom use disorder, which is the new terminology that we use to say kratom addiction, or cocaine addiction, we use cocaine use disorder, and so on. Now, the classification of a kratom use disorder, like other substance use disorders, have a severity from very mild to very severe. And what the data indicates is that people that are regularly using kratom can fit criteria for a kratom use disorder, but it tends to be mild or moderate. In very few cases, there's evidence of severe kratom use disorder, and those actually respond to buprenorphine treatment. So we, again, highlighting like what, in general, that overall at an individual level, we don't seem to see much pathology. But when you start to look at the population level, where the numbers become very large, then you start to document that it can produce addiction to kratom, and that it can produce overdoses and death. So what do we know about kratom involved overdoses and death? We know that it is possible. In 2017, the FDA reported at least 44 deaths in association with kratom use. But most of those deaths also have many other substances on board, very likely the cause of why the person died. And in fact, if you look at also from that same data, 0.56% of people who died of accidental drug overdoses were for kratom. So it's a small percentage. And of that small percentage, the majority of them, specifically for this study, 87% had or involved other polysubstances. And the other element is for those that didn't involve other polysubstances, there were contaminants and extremely high doses of mitragynine and 7-hydroxymitragynine. with this in notion, we say, well, how do we need to evaluate? Because it's always benefits risk. So the risk of overdosing is very low, and certainly nothing compared with what we're seeing currently in our country. But are there other ill effects? And as I say, and I really apologize because I don't know why the figures are not showing up. But what it indicated is what are some of the negative health effects that have been reported in certain people. And again, in general, it tends to be much higher doses or drug combinations or people that have vulnerability. So what do people die when they take kratom alone? I say arrhythmias, seizures, and liver failure. And again, I want to emphasize these are rare occurrences, but they do happen. And so research to investigate what factors can allow us to predict who is at risk and how to actually protect them is crucial. So in the last two slides, just from the perspective of health and safety, again, very low evidence that the use of kratom produces respiratory depression. But there are many things that we do not know that are important. We don't know how kratom products that are being sold with various contaminants influences health. We do not know much about that drug interaction. So you are in a medication and you're taking kratom. It becomes important to see that these drugs don't counteract one another or enhance one another. We don't have data on the long-term effects of kratom. And we also don't have data on the effects of the use of kratom during pregnancy. And again, the safety effects when someone is intoxicated on their kratom are there safety considerations. So as I started my presentation, we have limited information. Why? Well, most of the data that we have is self-observation or reports, which are valuable, but actually not sufficient. We also know that most of the individuals taking kratom may be taking other drugs, so it is difficult to disentangle the effects of kratom from these other substances. What makes it hard? Several things make it hard. We don't have sufficient availability of kratom products for research purposes or the content, the active ingredients. And also, we don't have right now an FDA approved constituent of kratom for clinical trials, approved to actually go forward for clinical trials. As a result, we do not have studies that have evaluated the therapeutic potential that mitragynine may have for the treatment of pain, for the treatment of addiction, for the treatment of depression, or other conditions. So what is it that we're doing? This just identify some of the areas that we are right now funding to try to advance the science. I want to sort of state that one of the key things that we have invested significant resources is into the synthesis of a mitragynine product that will allow us to actually do the randomized clinical trials to clarify what may be the potential benefits of kratom. Again, not just for pain treatment, for also for the treatment of drug addiction. We actually are very much open and recognize that one of the problems that we are facing right now in terms of mitragynine or 7-hydroxymitragynine is we don't know sufficient. We know people are taking it, reporting beneficial effects, but actually there's no oversight. There's no way of quantifying how to properly see the value. And with that, I want to thank you for your attention. And I don't know who's the second speaker. Are you, Jack?